Very exciting partnership. The goal was to create New Jersey's only private medical school. So there's two other medical schools in New Jersey. There's the Rutgers system, and then there's Rowan Cooper down in the Camden area. Those are both publicly sponsored schools. This will be New Jersey's only private medical school. There's a significant physician shortage in New Jersey and across the country, and we believe that this will help to address that. There's also a terrible talent drain of medical students that are seeking medical education out of state or even offshore. And one of the goals of this new medical school will be to retain talent in New Jersey and also attract the best of the best that's out there elsewhere. We lose a lot of talented students even to New York and Philadelphia. As you know, and Rutgers and Rowan are fine medical schools, but there are students from New Jersey that are seeking a private medical school, and they don't have that alternative within the state. So we're creating a 4-year school of medicine, 125 students per class, and what's even more exciting to me than just creating a private medical school is the fact that it's going to be truly one of the few in the entire country that will offer interprofessional education, meaning that Seton Hall will be relocating their College of Nursing and their health science schools, and those will be integrated into the School of Medicine. So traditionally, all of those professionals, if you will, professional students, were being educated in silos. But yet, after they finish school, they'd be coming to a healthcare system or to a hospital, and they'd be expected to work as a team. So we're going to break down those silos, and we're going to educate them within a single classroom wherever possible, and certainly within similar learning laboratories. Well, I think it just offers some alternatives to students out there. One, obviously the obvious is one is dependent on more dependent on public and governmental funding, and the other one is funded privately. But if you look across the country, there are great private medical schools and there are great public medical schools. I think that's what makes medical education so great in our nation, is that there are those kinds of choices. And with the population of New Jersey, what it is, and being one of the most robust states in terms of healthcare and healthcare delivery, it just makes sense that we offer those kind of choices to residents of our state. With the physician shortage continuing to grow, I do believe that there's a need for additional schools, and I don't think it will hurt the existing schools at all. This school will address specific needs of specialties that are in short supply. So that would mean primary care, including internal medicine, family practice, pediatrics, obstetrics, gynecology, and even general surgery, where we're seeing a significant shortage of general surgeons. So our focus will be on giving priority to New Jersey students, and also to students who want to practice in those specialties that were in particularly short supply. I don't think so. Not with what's projected. I mean, just by the year 2020, they're projecting we're going to be 3,000 physicians short, and that's taking into consideration the existing medical schools that are here. So I think there's a definite need for this school as we move forward. And the other thing is, like I said, this school will actually have that interprofessional education, which will be really innovative and creative. And I think it has the potential anyway to really change the way the healthcare delivery system, how healthcare is being delivered within the system. To really, it's a team. Healthcare delivery is really a team sport, and we have to start thinking that way, even as people are being educated.